Hi, so we're here with Dr. Ravi Gowda, who's going to help talk to us about how to go on holiday or on our travels in a much safer way. Because Dr. Ravi Gowda is a consultant in infectious diseases, and he's been a consultant at the University Hospitals in Coventry for the last 5 years. And during his 22 years of training, he spent 12 years just training in infectious diseases, and he's done a diploma in infectious diseases at Liverpool as well. So I'm really pleased to talk to Ravi about this because it's something that I think a lot of us need to know a little bit more about. So Ravi, thank you for coming and meeting us.
Thank you, Alan. Thank you for inviting me.
Great. So I'm just wondering, Ravi, if we were going on a holiday or on a travel expedition to, a more exotic or far-flung place, what advice could you give us on how to, maybe take a few extra precautions just to keep ourselves healthy so that we can be more productive or enjoy our holiday in a better way?
Well, Nalin, it really depends on who you are and where you're going to. So perhaps I can give you an example. If you're a family of four with a couple of kids and you're going on safari to Tanzania, that poses specific risks. And where you should really start is from the very beginning. You should really get appropriate travel advice before you travel. Now, you'd want to think about things like the flight itself, making sure you're active and mobile and that you adequately hydrate yourself so that you're not at risk of developing clots in your legs. And then when you get to your destination, you need to think about sun protection. You need to make sure you get the appropriate strength sun cream. You need to think about other general measures. So for example, you need to have the appropriate strength insecticide repellent. Now, the active ingredient is something called DEET, and we know that it's got to be 50% concentrated. Anything more is no better. Anything less is not optimal. So about 50%. That's really important. Then, of course, you've got other things such as food and waterborne risks. And again, you've got to make sure you know how to access safe and clean drinking water. Then there are more specific risk management issues, such as you need to know what vaccines to take, such as typhoid and hepatitis A, and you might be at risk of things like malaria, and you certainly would be in Tanzania, and you've got to know what particular malaria prevention tablets work and what don't, and what the side effects are. So that's just one example. Another example might be you might be a backpacker going through Southeast Asia in countries like Laos or Vietnam or Thailand. Now, these countries, and in particular at certain times of the year, present different risks. So, for example, you might be at risk of viral infections such as dengue or chikungunya, which can be very serious and debilitating. Or there may be specific resistant malaria in certain parts of Southeast Asia. Again, you need to know what to take and whether they will work or not. Finally, if I could give you a third example, you might be somebody who's middle-aged, has had cancer and has had chemotherapy, and you're recovering from that. And you think, well, actually, I need to go and see the world, and you decide to go do something different, and you go to South America, and you might go on a conservation trip to the Amazon. Now, again, this presents a different risk to the other scenarios that I've presented. So, in this case, you'd be at specific risk of something called yellow fever, which is another viral infection transmitted by mosquitoes, which if you catch or acquire, this can be very serious. So it's associated with a 50% mortality, so 50% of the people who acquire it can die. Luckily, there is a good vaccine, and it's very effective, but what you really need is expert advice, because this vaccine itself can be dangerous and can cause very serious side effects in this type of individuals. In this type of individual. Now, what you need is a person who can tell you what the risk versus the benefit is and which component outweighs the other, and then you can make a more informed choice as to whether A, you go to this area considering the risks, and B, whether the vaccine is appropriate for you or not. So in a nutshell, really, you think about the individual and their risk, but also the risk in the place of travel. So these are the important areas, and what's really, really crucial is that you get an appropriate resource wherever that might be.
So if I was looking to get some, really good advice just for me, just that was tailored to my needs, going to a certain specific place, what advice could you give me, Dr. Gowda, on how I could find the right kind of information for what I need?
Well, not only you've got several options. First of all, you might want to ask a friend who's been to the area where you are going to, but that might be anecdotal and a bit hit and miss. You might want to do your own online research, and there are some very good websites who will give you good information, and that's not bad either. And thirdly, there are some online services whereby you type in your information, your data as to where you're going, and at some point later somebody will email you back with the appropriate advice, and it's usually a nurse at the other end. Then you've got your online pharmacist, so not your online pharmacist, but your high street pharmacist who can advise you on things like vaccinations and malaria prevention. Or you might prefer to go and see your own GP. Again, it's usually a practice nurse that will give you the advice, and sometimes the appointments need to be made well in advance, and you may not always get the appointment suited to you. Finally, your sixth option, I guess, is an independent travel clinic. Now, these are usually specialized, dedicated clinics where the nurse is usually a specialist in travel health, and sometimes there's also a doctor. It might be an infectious diseases doctor who will also oversee that clinic, and that's your sort of final option, really.
Okay, well that's really helpful, and I can see that the grades of expertise that you get as you go up that. And I know, Dr. Gowda, that you run a travel clinic service yourself in Coventry, and I just wondered, if we were to maybe try and contact you, maybe by filling out the online form, what might we expect to happen after that?
Well, the online form is really an information gathering process, and what then happens is that we will have a look at that, and initially our specialist travel nurse will look at that, who's I'll ensure that she's appropriately trained, and I will have sort of overall governance of the process, and what we'll do is that we'll look at the individual. We'll look at the age, for example. We'll look at the past medical problems, any particular medications that might interact with what we might give, and we'll look at specific problems. For example, it might be a pregnant woman who wants to go to Kenya, and we would probably say, well, actually the risks are very high, in particular risks such as malaria, and we would strongly advise you not to go, and that's very important. And then we will look at, as I said previously, where you're going, the terrain, the altitude, because all those things actually pose different risks, and what we want to do is we want to sort of bring that together, the risks of the individual and the risks of the destination. Well, the way we bring it together is really through expertise. Now, I've been a consultant for the last 5 years at University Hospital Coventry, I've trained specifically in infectious diseases over the last 12 years. I have an interest in tropical diseases. I've been a doctor for 22 years. I've also attained the Diploma of Tropical Medicine and Hygiene at the School of Tropical Medicine in Liverpool. So I can say that I've got plenty of experience in infectious diseases, and hopefully I'm the right person to give you that advice.
Okay, well that sounds really interesting, and I think certainly if I was in the Coventry area and I wanted to get in touch with you, I just wondered how would I best do that?
Well, there are several ways. An easy way is to go to our website, which is travelclinics.com. If you prefer to email us, you can email us at appointments@travelclinics.com, or if you'd rather pick up a phone, you can ring 02476 016519. What I'd like to say is that if you did go to our website, we have a sort of online booking form or inquiry form on the homepage on the right hand side. You click on that and you can make an informal inquiry, or you can make a specific inquiry and just send it off to us, and we'll answer that as soon as we can.
And I know we could probably do that before we went on one of these trips, but if I was worried after one of these trips and I maybe had some diarrhea, and I was worried that I wasn't sure if it was just a normal bug that I'd got, or whether I'd picked something up from my travels, or I had a temperature that wouldn't get away, or a cough, and I was worried that this might be something that I'd caught whilst I was on holiday. Do you offer anything to help me in that situation as well?
Well, that's how we differ from other clinics to your GP or your pharmacist, in that we provide specialist infectious diseases and tropical medicine consultations. So you might have been, for example, an aid worker working in Haiti, and you come back with diarrhea. Now this could be typhoid, it could be simple gastroenteritis, but you might have something like cholera, which is endemic in certain parts of Haiti. So we'd be able to sort of assess you and evaluate you and give you the appropriate advice. We can give you the appropriate treatment if we need to, or if we need to get you admitted, we can do that through our own system within the hospital. It may be that you may have come back from Uganda, or you may have come back from Nigeria, and you come back with a fever, and you think, well, have I got malaria or not? Well, we can evaluate you. We can do the clinical assessment. We can do the appropriate test to see if you've got malaria. A simple blood test is all that is needed, and then we'll be able to confirm the diagnosis and, importantly, act promptly, because sometimes with certain conditions, particularly malaria, if you delay the treatment or if you delay the diagnosis, that can be disastrous, because every year a dozen of people die from malaria after having contracted it from abroad. So it's really important to make an early diagnosis from an appropriately trained individual, really.
Okay, well that's really helpful, because obviously sometimes you have these doubts and you don't know whether to go to the GP or to the emergency department, but I guess going to you as a consultant in infectious diseases, that would be a really quick way of getting peace of mind. So that was really helpful. Thanks for spending your time this time with us, Dr. Gowda, and it's been I hope you have a good day.
No problem. Thank you, Nalin.
Okay, you are.